A question I've been getting a lot lately is which test do I need to do if I'm worried that I have COVID? So I put together this simple chart to help you understand which test you may want to do. And it's fairly easy to understand. There's two types of tests out there. One test for the antigen, one test for the antibody. The antigen is looking for the live virus. The antigen is something foreign to your body, and that's where it gets its name. So this says that there's an antigen, there's a virus foreign to your body. The antibody says that you've developed an immune response to this foreign object, and now you have antibodies or an immune reaction to that. So the two different types, is one is a swab. The antigen is always a swab, and the antibody is always a blood draw. So let's talk about the antigen first. Once again, that is the live viral particle that you're looking for, so you must swab for it. Typically, these are nasal swabs. Some can be done in the oral cavity, but most people do these in the nasal cavity. Seems to be more effective. There's a rapid swab and a send-out swab, and that really becomes important in the timing to get your results. The rapid swab you get back in 15 minutes or so. The send-out swab takes anywhere from 3 to 5 days, depending on availability, or if the lab's backed up in your area, can take as long as 10 to 14 days if there's a lot of tests being run and the machines can't keep up. Now, when can you do the test? That part's important. So with the swabs, you can do them anytime after your symptoms start. Now, technically, if you don't have any symptoms of the disease, you can still flag positive, but most of the time we're telling people, if you don't have symptoms, there's not really a lot of reason to get swabbed. Now, there's surgery centers and different physicians or different areas are asking for people to get swabbed if they've been exposed or something like that. But the deal is that if you get swabbed, it tells you that you may not have the virus at that time, but you certainly can develop in the hours afterwards. The swab is not perfect, and it does miss cases. So you can swab anytime after the symptom onset and up to about 14 days after the symptoms. Now, if you've been watching the news articles and things, there's some people that are being positive for weeks to even months after their initial diagnosis, but I don't think we fully understand that. The main answer you want to know is, do you have COVID or not? The best test to do is you need to do the antigen test, and it needs to be either rapid or send out, but you can do it anytime after your symptom onset. If the test misses it, you may want to repeat the test maybe a day or two later if you were negative and you feel like it was a false negative, because these tests are not perfect. Now, the next version of the test is the antibody test. This is a little later. You can't do this as early as the antigen test. You have to wait at least 3 days after symptom onset. And the reason why is because you're looking for the body's immune reaction to the virus. So the minute you have symptoms, you don't necessarily have antibodies. You start developing those antibodies as your symptoms develop. So the earliest you'll find those antibodies is about 3 days afterwards. But even if you're negative at 3 days, you can't say that you are negative. You have to wait longer. So that's why they say you can't make the diagnosis off antibodies, because it takes longer to develop those. And there's two types of antibodies. There's an IgM antibody, which says that you've recently had the infection. And then there's an IgG antibody, which says that you've had the infection for at least 5 days, more likely 14 days or longer. So the IgM antibodies appear first in this 3 to 7 day window. They're the first ones up and the first ones down, and then the IgG antibodies take over, and those will create a longer term immunity. Now, we don't know at this point how long that longer term immunity is. For things like vaccines, tetanus and all that, you can develop long-term immunity. That's why you only need the tetanus shot every 10 years or so. We don't understand COVID yet, and we don't really understand how long the immunity lasts. But suffice it to say that if you have antibodies towards the virus, you most likely recently had it, since the outbreak's only been going on since February, March of 2020. But you can consider yourself immune if you've got antibodies. That's not really a warrant to go out and party and play and get exposed to it again, because we don't fully understand this virus and if you can get reinfected or not. Although I'm not the biggest believer that you can get reinfected. I believe it's more of a you never cleared it, but that's not proven in science. That's just my opinion right now. There are two types of antibody tests. The antibody tests are always blood draws. All right, they're always blood. So there's a rapid blood spot, which is just the finger stick, and you take a couple drops of blood, you put it in the machine, and you get an answer in about 15 minutes, 20 minutes, somewhere around there. The blood draw version is a send out, just like the swab is a send out. So you send that to a formal lab. They analyze it. Typically, the turnaround time is 3 to 5 days. Now, in everything in science, typically the faster you do something, the more inaccurate it is. So the rapid blood spot is more likely to miss the antibody. It's pretty good, but it's more likely to miss the antibodies, whereas the formal send out is more likely to pick it up. This does not actually work for the rapid swab. The rapid swab is actually thought to be more active because you're looking for, once again, the live virus. And so if the live virus has to go out into a transport tube, it's got to be put into a tube with some medium to try to keep it stable. And then it's got to survive to the lab, and then it's got to live in the lab long enough for the lab to actually run the sample. All those things can actually allow the virus to break down and disappear over time. So the send-out swab is actually less accurate than the rapid swab. The rapid swab is thought to be the best, something above 90% sensitivity of it detecting the virus. The reason why is because the swab goes first into you and then directly into the machine, doesn't need to be transported or anything. It's right there and active. So to do a quick little summary of that, because that's the basics of it, you have an antigen test, which is if you have symptoms right now, that's looking for the live virus. That's a swab. The most accurate, best version is the rapid swab. That takes about 15 minutes, just like the flu swab if you've ever had one, and you've got your answer. There is a send-out swab. That's the most common one that people are doing right now until those rapid machines get more abundant, but that can take 3 to 5 days, a little less accurate. The antibody test is to prove whether you have immunity to it, but it can only be done at least after 3 days. But if you're hanging your hat on this 3 days, you should at least test yourself again by a week later to make sure that you still don't have those antibodies. But even still, there's some concern that people who are getting COVID don't necessarily develop antibodies to it. And we're going to find more about that as studies come out. The rapid blood draw is less accurate, takes 15 minutes. The send-out blood draw is a 3 to 5 days. So hopefully this answers the basic questions of if I have COVID or if I'm worried I have COVID or if I've been exposed to COVID, which test do I do? And actually, I guess I didn't answer that if I've been exposed to COVID. So if you've been exposed to COVID and you don't know what test to do, if you never develop symptoms, you may not want to do the swab since you don't know when to swab, but you could do the antibodies to see if maybe you were one of the asymptomatic cases or the cases that didn't get any symptoms but still developed immunity to it. You can do the blood draw. I'd probably recommend doing the rapid one just because it's cheap and easy. You get your answer really quickly, but it is a little less accurate. So that's the summary. If you have any friends or anything, please share this video so that we can get this simple answer out there as far as if I'm sick, which test do I do? A lot of people are trying to avoid the swab because nobody wants a stick shoved up their nose, but the blood test simply is not as accurate. You need to lean on the swabs right now. And that's it. Hope this helps. Share the video.